Hi everyone, welcome back to my channel. Is Skin Journal Shama Violet, is Farm Dr. Shama Violet Shukupo, and today we are talking about something that affects millions of women worldwide, PCOS, and the growing conversation around what some people are now calling PMOS. So now, before we begin, let's clear something up. The officially recognized medical term is still PCOS, polycystic ovary syndrome. However, many experts believe the name is misleading because not everyone with PCOS actually have ovarian cyst. Because of this, some researchers and health advocates have started using the term like PMOS, meaning PolyMetabolic Ovary Syndrome, to highlight that this condition is not just about the ovaries, it affects the entire body, especially metabolism, hormones, and even the skin. So in today's video, we will discuss what PCOS or PMOS really means, how it affects the skin, why these skin changes happen, and the best management option. Now, let's get into it. What is PCOS or PMOS? PCOS is a hormonal and metabolic condition that affects how the ovaries function. Women with PCOS may experience irregular period, difficulty ovulating, weight gain, excess facial or body hair, acne, hair thinning, fertility challenges. But here is the important part. The PCOS is not only a reproductive disorder, it's deeply connected to insulin resistance, inflammation, hormonal imbalance, and metabolic dysfunction. And that's why most people feel the term PMOS better reflects the condition. How does this PCOS affect the skin? You know, the skin is actually one of the biggest places where hormonal imbalance shows up in the sense that number one, acne. It shows as acne, which is one of the most common skin symptoms called hormonal acne. It usually appears around the jawline, the chin, the lower cheek, the neck. So now, why does this happen? You know, in PCOS, the body often produces excess androgens, which is commonly called the male hormones like testosterone. This hormone increases the oil production in the skin, it clogs the pore, and it triggers inflammation. However, the persistent acne that may not respond to regular skincare products. All right. So we have number two, which is the excess facial hair, which is the hirsutism. Okay. So another major symptoms is this unwanted hair growth, which can appear at the chin, the upper lip, the chest, the abdomen. Again, high androgen levels stimulate thicker and darker hair growth. Many women find this emotionally distressing and it can affect confidence and mental health. So number three is dark patches on the skin. Most women with PCOS develop dark velvety patches, especially around the neck, the underarm, the groin, and so on. So this is usually called acatosis nigricans. Okay, when you hear about acatosis nigricans, is this dark patches on the skin. All right, so it's usually linked to insulin resistance, meaning that the body is struggling to use insulin, properly. So this is an important sign because it may indicate the higher risk of pre-diabetes, type 2 diabetes, or metabolic syndrome. All right, so the number four is hair thinning or hair loss. So why excess hair may grow on the face, on the scalp. So the hair on the scalp may also, actually thin out. This is called androgenic alopecia or female pattern hair loss. It commonly affects the crown of the scalp, the hairline, and overall hair density. So hormonal imbalance shortens the hair growth cycle, usually causing the gradual thinning. All right. So why does all this happen? The three major drivers are the hormonal imbalance, um, the elevated androgen, and the insulin resistance. So high insulin level stimulates more androgen production. Okay. Now, there is also chronic inflammation. This low-grade inflammation will worsen both the hormonal imbalance and the skin issue. So management has to go deeper than just skincare products. All right. So what are the management of PCOS related to skin problem? Now let's discuss solution. Now, number one, we talk about the changes, the lifestyle changes. All right. So this is just the foundation, because an healthy lifestyle can significantly improve the hormones, the insulin sensitivity, acne, and weight management. So helpful habits include regular exercise, high fiber meal, protein rich diet, reducing excessive sugar intake, getting enough sleep, managing your stress. Even small changes can make a difference, over time. So number two is the medical treatment. You know, uh, healthcare practitioner may prescribe hormonal contraceptives, hormonal contraceptives to regulate the hormone, anti-androgen medication like spironolactone, metformin for insulin resistance, and other acne medication when needed. So always speak with your healthcare professional before starting any treatment. All right. So the third one, which is skincare management for acne prone skin, you can get gentle cleansers, salicylic acid, benzoyl peroxide, retinoids, and make sure your moisturizer is non-comedogenic, and so on. Okay, so here consistency is the key. So always avoid harsh scrubs or over cleansing, because they can worsen the inflammation. So number four is the hair removal treatment. For excessive facial hair, you can go for laser hair removal, waxing, or threading. All right. So, but hormonal control is still important, or the hair may continue returning. All right. So now for mental health support, PCOS doesn't just affect the body, it affect the emotional well-being too. So many women struggle with anxiety, low self-esteem, depression, body image issue. So seeking support here is absolutely okay. So my final thoughts, whether people call it PCOS or PMOS, one thing is clear: the condition is much bigger than just ovarian cysts, because it affects the hormone, the metabolism, the skin, the hair, the mental health, and overall quality of life. But the good news is that with proper management, symptoms may improve significantly. And remember, your skin may be revealing what's happening internally. So always pay attention to those signs. Okay. So if you found this video helpful, don't forget to like this video, subscribe to the channel, share with someone who may need this information. Thank you so much for watching till the end, and I'll see you in my next video. Bye.